Thank you for joining me. I'm Juan, lead trader and founder of Prosperity Trade. In this video, I want to discuss a company that has connections to Google, Microsoft, and Yahoo. You're going to want to watch this video. So the ticker is RBOT, and we had an overall pullback in the market. A lot of stocks went down, and this was one of them. So this is the reason I'm doing this video now, because I'm going to increase my position. I'm already invested in this. I think this is going to be an innovative stock. It has some smart investors, smart CEOs. Over the next coming months, I'm going to do several videos about this company because it's too much to unpack. I want to divide it by breaking down their technology, their potential, comparing it to other companies. But this video is just an introduction. So what RBOT is doing is innovating the way surgical robots operate. So right now, the father or the most popular surgical device for laparoscopic surgery is the Davinci. So the Davinci, they received FDA approval in 2000, and it was created about 8 or 9 years before that. So that device has been created about 30 years ago. So you have to think about 30 years ago, how was technology, how was the climate, and it was kind of created in a way that mimics a lot of manufacturers' kind of robotic thinking. When the founders of Vicarious Surgical, when they created this, the two founders are MIT graduates. They both worked in Apple, and they really just kind of kept the surgeon in mind. They kept the hospital in mind and what's best for the patient. They surveyed the surgeons and really just gathered so much information to find out what issues they have with the current surgical device and what would make it better. And one of the things that kept coming up was basically the ease of use, dexterity, movement, freedom, and all those things. They basically changed the way it's being done. So that's why this is an exciting company. Right now, you see here the VR. If the surgeon is in the abdomen and they just want to look around, it's all natural head movement. They can move their arms, move the head, and just look around to see. One of the drawbacks and critiques of the Davinci is the difficultness of using it. It doesn't feel natural. In order to use the Davinci, you have to press a pedal and then you can move the camera. It's not easy to use. It takes a lot of training, a lot of getting used to. This device here, as you move your head, it moves, the camera moves, can kind of just look around and not be disorientated. The same thing with the hands. The hands we see here with the legacy single port technology, which is just kind of like this pipe and hand, and this is kind of the vision, right? With Vicarious, they have a 360 degree of visualization and access. They can look everywhere. And this is great. There's some surgeries that, because they have multiple arms, they require more incisions. Like they have some major surgeries in the abdomen that they call double dock. And it takes 3 or 4 incisions and it's done twice, one on one side and one on the other side. Problem is the majority of complications come with these incisions. So that's why back when they would do the open surgery, it's a large incision all across the body. You increase your side effects by 20% with such a large incision. With the robotic surgery, when they came like legacy, their laparoscopic incisions lowered the incisions to like 2.5 centimeters, and it still had like an 8.49% side effect issues. But with the Vicarious, their incision is as small as a dime, and it decreases it down to like 1%. So it's drastic. It's a drastic drop in the side effects of the surgery. So if we look here, the reason they have so much freedom, they can move around. These are smaller. They're not like the long robotic arms, and they have like these coupled actuators that just allow all type of movement, even movement that's not possible for humans. Like the way they can, these arms behind the back, you wouldn't be able to do it with your own hands, but you can do it with this device. So it actually has kind of like what they call a 9-degree set of motion, while the average has like a 7-degree set of motion. They're estimating to tap into a $136 billion market. This is where they feel they have an edge. Right now, if you want to buy the Davinci, it's a $2 million device. You have to basically build your OR around the Davinci. It's extensive training, and it's just not doable for a lot of rural hospitals. It's not possible. They're going to be a lot cheaper than the Davinci. They're going to be easily accessible. You'll be able to fold this, bring this to the OR. You don't have to build a whole OR for it. And the training, it's just such natural movement that it's going to cut the training drastically. This is one of the most exciting things I've seen so far. They received FDA Breakthrough designation, and they're the only robotic device that's ever received this. Looking here at breaking down what the Breakthrough device program, to sum it up, basically, the FDA is going to hold your hand. They're going to be your partner to help you get approval because they believe in your product. They believe that your device is going to change medicine. It's going to be it's so important to medicine that they're going to, they're going to help you get through the process. And there's also, because they're going through the FDA Breakthrough device, it increases their chance to get the FDA approval drastically, but it also gives them like certain rebates when they do get FDA approval for them to recoup some of the money, because right now they're not profitable, right? They have investors. They have smart investors. They got the connection that I mentioned about Google, Microsoft, and Yahoo. Yahoo's Peter Yang, he's invested. Bill Gates is invested. And former CEO of Google, Eric Schmitz, is invested, along with other investment groups. So this is like really exciting, and you have really smart people that see something, that know that this is going to change the way surgeries are done. The first thing I want to point out is their team. Their team is amazing. Adam and Sammy, these are the co-founders. They both went to MIT. They both went to Apple. They understand, they've learned I can't imagine the amount that they've learned at Apple and MIT. Their whole team has a strong resume. And that's one of the most exciting things to me. I've watched Adam be interviewed multiple times, and he just reemphasizes how important it was for him to get the feedback of hospitals and surgeons and what's going to be best economically for the hospital, right? What is it that they have to do to sell to the hospital? So he's basically, as he's building this, he's building the blueprint to get into the hospitals, because he's keeping the hospitals in mind. He kept their feedback in the process as he's building. He's talking to surgeons and taking surveys and seeing what they want, keeping all these people in mind as they build the product. And he also had made a great statement where he said, we could have created our robot a couple years earlier, but I also kept, he also kept in mind like mass producing it and scaling up, and how they're going to be profitable. How are they going to be able to build this product and keep some of that net income? Caused a 2-year delay, which is great news, which is what you want to hear. So when they're ready to mass produce, when they get FDA approval, this is already built in. They already know how to scale up and make themselves profitable. So again, on their board, they have the former head of Medtronic's robotics program, Paul Herms. But this is what I mentioned, like here, open surgery, complication rates, 15 to 20%. This is the single port, like the legacy, at 2.5 centimeters, still has an 8.4% complication rate. Theirs is down to 1.2%. These are just some of the limitations: the high cost, very difficult to use, limited capabilities, low utilization. They want to address the market. The CEO, actually, the founder, Adam, he said they feel they have the potential to be $100 billion company. In future videos, as they kind of release what their cost to make these robots and what their profits are, I want to create a DCF with addressable market cap, how much market share they can potentially attain, but also a side DCF of if they ever did reach $100 billion with the shares that they have outstanding and their debt and all that, what would that look like as far as stock price? And this is all speculation, of course, but as they release more information, because they haven't sold one device yet. If you're coming into this product now, you're coming in as an investor. It's not a value play, of course, it's a growth play. And with the pullback that we had today, they dropped to almost low SPAC $10 opening prices. So I'm excited to buy a lot more shares on Monday and get into this. So you see here, they'll have the VR, the hand movement, and this is what will be inside your abdomen performing the surgery. As they move the head, this camera moves. Easy usage. You see here, 9 degrees of freedom for the arm as opposed to 7. 1.5 centimeter single incision. Here's the Vicarious robot. This is existing single port robots, 2.5. 5 to 10 times lower capital cost. 30 patents issued and pending. You see here, it's going to be portable. As they put sutures, they also have what they call hepatic feedback. A lot of times, novice surgeons that use the robotics, they kind of break the suture sometimes because of the amount of pressure that they use. With the hepatic feedback, they can limit the pressure. So if they estimate whatever pressure, if you stop the pressure right here, for example, it'll just tighten the sutures without breaking them. And they can set an alarm to either stop if it surpasses whatever energy level, or a warning. That was just a brief introduction. It's my first video in the series of videos that I'm going to do. They're basically changing the way surgery is going to be done. They're going to have so many more surgeries that they're going to be able to do that surgical robots weren't able to do in the past. And they're way ahead of the competition. And now it's down at 1047. You know, even if it drops a couple dollars more because the way the market is pulling back, right now, this is to me, in my opinion, this is the best entry with the least amount of risk as opposed to getting in when it was at 15. I'm looking to increase my share size on Monday. I'm really excited about this company. I think once they get FDA approval, this is just going to launch. But other than that, you know, that'll come in future videos. So please look forward for future videos where we'll talk about more about the technology, pairing it. Who are the closest competitors? I think they're way ahead of the Davinci. I think the Davinci's great. It's been around forever, but it's a beast. It's a monster. It's huge. It's $2 million. It's expensive, and you have to build a whole operating room around it, and the training is very extensive. But we're going to compare it with other potential competitors in future videos. So please look out for that. Thank you for watching. Please subscribe, comment, and like, and see you on the next video.